So we're going to be doing a hematoma block. So what we're going to do is we're going to dilute out the medication we're using. So this is a 50 milliliter saline bag, and this is lidocaine 1% with epinephrine, and then this is bupivacaine for longer acting. So this is the bupivacaine. Drawing it into an insulin needle for the first part, and then injecting with a larger needle afterward. But right now what we're doing is we're loading up the medicines, mixing them into here. This is the lidocaine with epinephrine. Injected into this bag.
There's a leader on the top.
And it's all mixed together for a dilute, high volume, local anesthetic, just injected proximal to the fracture. Key is the insulin needle. So every ER has these because the nurses have to treat diabetes. And so it's a really small needle. You won't even be able to focus on it, it's so small. Actually, if I put my hand here, you might be able to see it better. Basically, these come in, I think it's a milliliter. And what you do, drop that milliliter, and that's your first injection. So all the nerve fibers, not all of them, but most of them, branch out at the dermis. So once you get under the dermis, you don't have a lot of pain when you're injecting it. And because it's such a small caliber, you get in there and they barely feel it. They often say it's a 1 out of 10 pain or a 2 out of 10 pain. And then the injection itself isn't super painful, but it has time. It's like the branches of a tree, is how one doctor described it. It's like the branches of a tree. You're getting it at the branch level rather than the leaf level, and so all the nerves are numbed up. Yes. At least. Okay. Okay. Vika. So we go all the way in under the dermis. Give the full cc. Went in with the insulin needle, injected 1 cc, and within about 15 to 45 seconds, it takes effect. So we're going to go in the same area. Okay. Vika. That's okay. Massagnazione. And we try to go deeper where she already had the injection, and then go deeper still. She's feeling that. And it takes a long time to act. When you dilute it out like this, it can take up to half an hour. And I use a high volume. It's okay? And generally, if you're not in the exact same spot, you don't have to withdraw everywhere. I do withdraw if I'm giving a little bit more in one area, but if you're kind of giving it in a more spread out fashion, you don't have to withdraw. That's according to a plastic surgeon in Canada that wrote a great review article named Lalonde. More now. We're just filling it up, high volume. This is why I diluted it out 50%. And why we're using epinephrine, so the patient can safely tolerate more. Okay, so this medication, when you use dilute, can take longer to act. But in this situation, patient says she has complete relief
Put us into it.
much earlier than expected, which can sometimes happen.
Okay.
So basically, we had done the initial injection, and then he went in and injected more right into the fracture itself, as you're supposed to do. And she just reports 100% complete relief. So the principles that made that happen is injecting proximal first, because all the nerves come in that direction. So when you use a high volume, you're actually sort of inadvertently doing a nerve block. And it could be somewhat analogous to the Tumescent technique, where you're just getting the entire digit numbed up. Diluting 50%, using high volume, taking your time, using a 29 gauge or 30 gauge insulin needle. Those are all the techniques. So the worst pain she ever had was what she described as 3 out of 10.